Hi, my name is Dr. Megan Bartram, and I'm a pediatrician at Valley Health Southside. I'm here today to talk to you about NAS. It's Neonatal Abstinence Syndrome. That occurs when babies are exposed to certain medicines. The baby can start withdrawing anytime shortly after birth or really up until a couple weeks of life. It's a constitution of symptoms that we see anywhere from just fussiness, inconsolability, poor feeding, tremors, jerking, all the way up until seizures. These symptoms are treated right after birth in a specialized unit, usually at Cabell Huntington Hospital in the NTU or at Lily's Place, where they are given a certain medication or just therapeutic handling to ease them through the withdrawal symptoms. Withdrawal can last weeks or sometimes up to a couple months, depending on the medicines or drugs that the baby was exposed to. These infants do tend to do very well throughout the weaning process if handled correctly and go on to be normal children. Research is showing there can be some behavioral side effects that we can see, school-aged kids, maybe some ADHD, but overall they tend to do very well. So it's really important once those babies are born that they be identified as soon as possible. The sooner we can see these infants and treat them, the better off their outcome and the easier the withdrawal can be. If the pediatrician or provider is notified in the hospital, they can watch for signs and symptoms, and it's extremely important that after they go home, they keep close follow-up. After discharge, even if the infant is treated within the hospital or in the outpatient center, they can still continue to have some withdrawal signs, through the first couple months of life, and those need to be monitored. They also usually have an NAS follow-up clinic that these babies should be seen at, where they're seen by the neurologist and child developmental specialists, because their development can be a little altered depending on how severe their withdrawal was or what they were exposed to. We have a special place in our heart for these babies, and we love seeing them and taking care of them. I see them in the hospital. I love to follow them as an outpatient and watch them grow. To learn more about pediatrics at Valley Health, visit valleyhealth.org.